Hello and welcome to Untitled Healthcare Solutions webinar. This is part of our COVID-19 government and industry update series, and today we're going to be talking about things that you can do to protect your practice, especially if you have a lot of online or remote workers right now. We know that's a hot button topic, so today we're going to be covering protecting your practice from hackers amidst the COVID-19 crisis. Wow, we really should have come up with an easier name to say, ladies. I am disappointed with that. But anyways, my name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I wanted to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next day or two here. Next, for those of you who are familiar with us, you'll notice that this is a different format than we traditionally offer. We're doing these brief mini webinars on topics that pertain to COVID-19 in hopes that your practice will find them helpful in managing the current crisis. I also wanted to mention that the upcoming webinars we have will be continuing in the COVID-19 mini-series. The next ones we have coming up are going to be utilizing next-gen mobile during the COVID-19 crisis. That's going to be on Friday. And then keeping your patients informed during the COVID-19 crisis with next-gen messaging solutions. That's going to be on Monday. If you haven't registered for those yet, you can register for them directly on our website in the events and education page. Otherwise, you can go back to the email that I sent that you used to register for this webinar, and you can find the registration links for those below. Okay, so back to today's webinar on hacking as they relate to COVID-19. At the end of my presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. We're going to leave everybody else's phone muted throughout the entire webinar. If you experience audio issues, use the chat box to let us know. And again, questions in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Alex Davis is Managing Consultant at Attentive Healthcare Solutions. So Alex, I'm going to go ahead and pass it off to you. Feel free to get started when you're ready.
Perfect. Thank you, Chelsea. Hi, everyone, and thank you for joining us today as we dive into how to protect you and your practice from hackers during the COVID-19 crisis. We know the emergence of COVID-19 has brought with it its chaos in many different economic sectors. However, it has also originated new cybersecurity threat, igniting a mass of COVID-19 themed phishing lures and newly registered COVID-19 related domains. The technology threat surrounding COVID-19 primarily appears to be around phishing, with actors promising attachments containing information about COVID-19. We are well aware that cybercriminals don't back off when crisis hits. They thrive amidst chaos and weakness, and right now, healthcare practices are facing just that. The World Health Organization has reportedly seen attempted cyber attacks double since the onset of COVID-19 crisis. And it is not just on practices or hospitals. A vaccine testing facility has also been targeted with ransomware. Attackers are continuing to use concerns over COVID-19 to distribute ransomware and malware, including in our smartphones and apps. It's a sad truth, but the healthcare sector is perhaps at the greatest risk of these attacks because it is serving as a frontline defense against the disease, which is why it is important that we have this webinar and share with you what we've seen and how to prevent something like this from happening to you and your practice. Just to fully communicate how big the threat has become, you can see the numbers of newly registered domains related to the coronavirus has since increased since the outbreak has become more widespread, with threat actors creating infrastructure to support malicious campaigns referring to COVID-19. So as we look at this graph, we are beginning to see in January 12, the number of domain registrations started to increase. Then we see an additional large spike on February 12th as seen. So why so what was so special about February 12th? The spike coincides with the largest single day and spike of COVID-19 cases reported, which was well thought out by hackers. The information is extremely troubling, which is why it's a good indicator that hackers had begun to realize the worth of COVID-19 as a cyber attack vector. Shortly after this, the U.S. Health and Human Services Department reported they were targeted with a cyber attack, complicating its efforts to coordinate nationwide response to the mounting coronavirus pandemic. The cyber attack involved a sustained attack with millions of hits to the agency's servers over the course of several hours. Luckily, though, it didn't cause any substantial damage to the health agency's response capabilities and didn't result in exfiltration of any data. The HHS spokesperson came out and stated the following message on this slide. In short, confirming that the attack happened and that no data was lost. HHS wasn't the only government agency targeted. Hackers have tried to infiltrate also the World Health Organization. So WHO Chief Information Security Officer said the identity of hackers was unclear, but the effort was unsuccessful. He warned that the attacking attempts against the agency and its partners have soared. The attempted break-in at the WHO organization was first flagged around March 13th, and then they picked up on activity when a group of hackers activated a malicious site mimicking the WHO's internal email system. This site essentially has been used in an attempt to steal passwords from the agency staffers. And to put this in perspective, this isn't just government agencies. A recent cyber attack closed down a hospital used for COVID-19 testing and treatment. The hospital was one of the largest COVID-19 testing facilities in Czech Republic and was forced to cancel operations and relocate new patients to other hospitals. Brno University Hospital is currently recovering capabilities, although is not fully operational. There are still no means of storing data, meaning that medics have to write and transfer the notes manually, which slows processes and potentially endangers lives. So with this information in mind and understanding the seriousness of these attacks posed, especially during the pandemic, we want to make sure that you are aware of the attacks coming in and what they look like. So at this time, I'm going to go ahead and pass it off to Lindsay to review these with you.
Great. Well, thank you, Alex. Let's just jump in right here with the most common examples of schemes or attacks being used on the healthcare industry related to COVID-19. And these are individuals and businesses selling fake cures for COVID-19 online and engaging in other forms of fraud, seeking donations fraudulently for illegitimate or non-existent charitable organizations, medical providers actually obtaining patient information for COVID-19 testing and then using that information to fraudulently bill for other tests or procedures, phishing emails from entities posing as the World Health Organization or as the Centers for Disease Control and Prevention, and then even malicious websites and apps that appear to share coronavirus-related information to gain and lock access to your devices until payment is received. Now, the last two are what we will focus on and provide examples on, since these have been impacting our clients and their patient populations directly. We've seen that malicious actors rely heavily on impersonation tactics. For example, official CDC announcements and executive communications, and either masked or used lookalike URLs from organizations like the CDC or the World Health Organization, typically seeking credentials or any other sort of confidential or financial information. Other cyber criminals have also been taking advantage of the public sphere around the virus by targeting phishing attacks. These have included attacks under the guise of informational and health advice emails, which were used to spread malware and actually gain access to sensitive information, as well as even going as far as to holding a US public health district's website hostage by ransomware. So there are a couple of things going on right now in terms of phishing scams. There's what's called fearware, and it's exactly what it sounds like. It's using a situation like COVID-19 to solicit a click on an image or click on a website link with the intention of either injecting some type of malicious code into your computer with that click, or soliciting some sort of credentials, meaning your usernames or passwords to something as simple as your Gmail or Outlook accounts, or maybe your bank accounts. There have also been a couple of phishing scams related to what I mentioned earlier of what looked like emails coming from the World Health Organization, where they're telling you, here's a new compliance document on COVID-19, click here. Some of these emails look very legit. The web address, if they spoof it correctly, might also look legit. But when people click on it, typically what happens is a virus downloads. Criminals are also disguising themselves as the World Health Organization, again, to steal money or sensitive information. So If you are contacted by a person or organization that appears to be from the World Health Organization, verify their authenticity before you consider opening anything or responding. Same thing goes here. Cybercriminals have also impersonated the U.S. Centers for Disease Control, or CDC, by creating domain names like the CDC's web address to request passwords, and even request Bitcoin donations to fund a fake vaccine. So the U.S. Federal Trade Commission has suggested that any interested parties just visit the known World Health Organization and CDC websites directly for up-to-date information, and to be extremely cautious about any email claiming to be from those entities. Also note that the CDC and WHO and other organizations like this do not take cryptocurrency payments, so any requests of this type should absolutely be considered malicious. Some malicious files are also being spread via email. Emails with document attachments claiming to have a list of precautionary measures against the infection can be phishing attempts. Another example we've seen is an Excel file distributed via email under the guise of a list of coronavirus victims, allegedly sent from the World Health Organization, which was in fact a Trojan downloader. So what that means is it secretly downloads and installs another malicious file, and that second file is actually a Trojan spy, meaning it's designed to gather various data. So it watches as you do your regular work on your computer, gathering passwords, financial data, usernames, etc., from the infected device and sends it back to the hacker. Others have also identified a phishing campaign, and it uses the subject line, "Attention, list of companies affected with coronavirus." That contained a malicious attachment that dropped what was called an Agent Tesla keylogger. And this attachment actually used the icon of a Microsoft Excel file to kind of masquerade itself as a legitimate Office document. And that Office document had the title of Safety Precautions. And it actually did have a .exe file extension. So again, they're doing a really great job of making these look legitimate. However, just emails on the subject of coronavirus are not the only thing threatening users, but they are the biggest threat that we've seen so far. Fake mobile apps have also become another outlet for malware as well. Hackers are really continuing to prey on people's fears surrounding coronavirus, and they're now resorting to apps claiming to provide information on the COVID-19 outbreak, basically to fool victims into installing malware on their devices. So one such fake app claims to notify users as soon as anyone is infected with the virus nearby. The app actually locks the victim's phone and demands for a ransom to lift the encryption. There are also fake apps that claim, I know I've seen one, that it can tell you where you can go buy an N95 mask right now and where it's near you. These are all hoaxes. The moment a user downloads one of these apps, it will corrupt your smartphone or your laptop or your iPad or tablet and ask for a ransom to unlock it. Another security company actually found a malicious app that is essentially a copy of the legitimate coronavirus tracker that's maintained by Johns Hopkins University. Only this copy has a Trojan malware in it. So upon first launch, the app actually informs the user it does not require any special access. But the screens right after that actually asks for access to your photos, access to your media, access to any files, and access to your device location. With that type of access, again, that's accessing your email, that's accessing your calendar, whatever else you may have on your phone or tablets. So in response to these phishing attacks and other schemes, Attorney General William Barr actually sent a memo to all U.S. attorneys, specifically directing them to prioritize the investigation and prosecution of coronavirus-related fraud schemes. So we aren't the only ones, almost disgusted by this, kind of preying on those who are fearful of this virus. So, and actually in a follow-up email or memo issued on March 19th, Deputy Attorney General Jeffrey Rosen further directed each U.S. attorney to actually appoint a coronavirus fraud coordinator to serve as the legal counsel for the Federal Judicial District on matters relating to coronavirus, direct the prosecution of coronavirus-related crimes, and to conduct outreach and awareness. So you can see the highlighted portion of the memo that we included. I mean, no one is taking this lightly. However, we have found that not all cyber criminals are heartless. Some ransomware operators have actually stated that they will no longer target health and medical organizations during the coronavirus pandemic. So a company actually reached out to operators of ransomware. Some of the ones that were included or named were Maze, Doppelpaymer, and Rook, and other various kind of forms of ransomware infections. And they did this using a post on the dark web. And basically, it's almost like a newsletter sending out where it asked if they would continue targeting health and medical organizations during this outbreak. Some ransomware operators actually responded and came out and stated that they will no longer target any health and medical organizations during this crisis. So you can see some of the responses above saying things like the Internal Health Organization conducts vaccine tests. We follow the news. If there's actual evidence of the laboratory working on the vaccine, of course, we will give the key for free. We're not enemies of humanity. But of course, another warning here, but commercial laboratories that are trying to trick us will never get the key. Our goal is money, not harm. A much more straightforward and reassuring response was, we will stop all activity versus all kinds of medical organizations until the stabilization of the situation with the virus. And then we had some longer responses that we can see on the bottom here, stating, we always try to avoid hospitals and nursing homes. And if it's some local government, we always do not touch the 911, not only now. And if we do so by mistake, we'll decrypt it for free. However, they also kind of add in their own kind of warning as well, that some companies are trying to represent themselves as something else, specifically pharma companies. It doesn't sound like they're going to let up on them, but either I hope that this either provided some hope for people on the line, or at least a good laugh that these ransomware operators are willing to actually respond and give us a response saying that they'll stop and kind of insert their own warnings and things throughout. But it's good to know that everyone is aware of this and is working hopefully towards the same goal. But what we really want to focus on is what your practices can do to stay safe from cyber attacks, because even though these ransomware attackers sound so sincere, there's still the chance that this could target your practice and impact your users. So what should you do? We can see these phishing techniques and malware are evolving, and they're going to continue to evolve. And it's difficult to detect a cyber attack before it's too late. So we recommend practices focus on two main areas. The first is going to be prevention efforts. So think both in terms of awareness training for employees and staff, and also the robust technical prevention controls, firewalls, antivirals, things like that, that will be on your system. But also the second part, the creation of a solid business continuity plan in the event of a ransomware attack. So keeping both of these things in mind, let's look at what you should be doing at the practice level. So at a time like this, we're seeing an upswing in malware attacks against hospitals and practices. And at the same time, you're also seeing an influx in patients. So this is going to put additional stresses on your system. So it's definitely a good idea to test and verify that everything is working and you have what you need in place. So first, understand the risks you face. This may seem obvious to recommend simply to understand the risks that your organizations face right now, but we cannot overstate the importance of doing just that. A great way to do that and to identify these risks are through your security risk analysis. That should be done annually anyway. Review your 2019 security risk analysis, or review your 2020 if you've had it done already, and really see what your practice is facing and what vulnerabilities you may have. Develop adequate policies. Many organizations were thrown into the situation and hadn't yet developed and published detailed and thorough policies for various types of email, web, social media, and other tools that are used by their employees. These policies should be put into place and be communicated to staff as soon as possible. Keep operating systems, security software, and patches up to date for all devices. Application and system vulnerabilities truly can allow cybercriminals to successfully infiltrate defenses. It's one of the top ways they get in. So every application and system should be inspected for vulnerabilities and brought up to date using those latest patches. Ensure you have good business continuity efforts. Backup and recovery plans are essential. Back up your data regularly and verify the integrity of those backups. Test your backup and disaster recovery plans. Again, business continuity for practices is paramount right now to continue to see patients. Support your IT teams and provide additional resources if possible. IT teams must have sufficient resilience and bandwidth to deal with a wave of IT issues and questions from users. Make sure your team is ready for this, especially as more and more people work from home or are conducting telehealth visits in your practice. We don't want these requests and assistance, this type of assistance as well, to lead to a lag in your security. And lastly, but most importantly, implement best practices for user behavior. As an organization, provide clear guidance and encourage communication. Train and educate. Make sure employees are aware of the types of phishing and ransomware out there right now and their critical roles in protecting the organization's data. I mean, they're truly on the front lines of this, both serving patients and treating patients of COVID-19, but also in the virtual realm of this as well, protecting your practice. So all of these things go beyond, what you might have expected me to say or the usual of deploying anti-phishing or anti-ransomware countermeasures. Make sure that you have anti-malware solutions that are set to automatically update or conduct regular scans. I wanted to go beyond just software-based protections of antivirus or firewalls, because, while that all is important, it's almost a given these days. So let's focus on these more high-level action-oriented defenses for your practice. So going off our last bullet of user behavior, we have to be prepared to alter our definition of normal due to the modified working arrangements. As businesses and our practices are forced by COVID-19 to encourage their employees to work from home, it is critical that you employ cybersecurity practices to reduce the risks of falling for phishing attacks or malware. So you can do this by providing a VPN for staff to connect securely to the corporate network. Ensure all corporately owned or managed devices are equipped with essential security capabilities, essentially extending the same network security best practices that exist within the enterprise to all remote environments. Again, operating systems and apps should be updated with the latest patches. Restrict the access rights of people connecting to the corporate network. And ensure that staff are aware of the dangers of unsolicited messages. Again, attackers are taking advantage of the fact that many people who are working from home have not applied the same security on their networks that would be in place in a corporate environment, or that enterprises haven't deployed the right technologies or corporate security policies to ensure that all corporate-owned or corporate-managed devices have the exact same security protections, regardless of whether they're connected to an enterprise network or an open at-home Wi-Fi network. As an individual, make sure you're practicing these security basics and take preventative measures, such as maintaining good password hygiene. Staff should use complex passwords, even multi-factor authentication where possible, and make sure to change these passwords frequently. Again, you're going to see me say update systems and software. Make sure your staff members, your individuals know about updates and are installing updates on their own devices and patches in a timely manner. That includes mobile devices and any other non-corporate devices they might use for work. Secure your Wi-Fi access point. People should change their default settings and passwords on their own home Wi-Fi in order to reduce the potential impact on their work of an attack via these connected devices. Use your virtual private network or your VPN if it's available. VPNs really are there to help create a trusted connection between employees and their organizations and ensure ongoing access to corporate tools. These corporate VPNs provide additional protections against phishing and malware attacks the same way corporate firewalls do in the office. Be wary of COVID-19 scams. We've seen the phishing emails, the malicious domains, and fake apps out there that are in the wild already. We know threat actors love to exploit real-world tragedies, and unfortunately, COVID-19 is no different. And lastly, don't mix personal and work. Employees should use their own work devices to do work and then their personal devices for personal matters. If you wouldn't install or use a service while you're at the office, don't do it while you're at home on your work device. You know, there truly is a sense of forgetfulness when it comes to security when you're working from home, and can be especially true for those who are not used to working from home. People working from home get easily distracted, especially if they're normally used to working in the office, and they can mix work with personal. I mean, think of it as simple as looking at your personal email or personal web browsing, which can lead to one of these types of attacks. So here's my advice to all of you. Keep your common sense. You know, current levels of anxiety and stress mean that some employees may not be thinking clearly, and corporate communications and systems, as well as business processes, may not fully be in place. This makes an attractive target for the misuse, abuse, fraud, or any kind of phishing scams, and any kind of otherwise unauthorized entry to systems by cybercriminals. This, combined with the fact that for many people now working from home, this may be the first time they've ever been issued a work laptop or other device for remote working. Remote workers may have trouble differentiating legitimate communications from attack attempts as they struggle to come up to speed on what may be unfamiliar systems to them. So taking these relatively straightforward steps at both an enterprise and an individual level should help address some of the most common security risks facing our current environment. But, you know, just as a few go-to reminders, don't make any assumptions about remote employees' digital or cybersecurity literacy. Treat all emails regarding the COVID-19 outbreak with caution. Be especially wary of any email coming from the CDC or World Health Organization. And avoid opening attachments from an email address you've never communicated with before. We should also recognize that our threat environment is not static. This means it's important to keep a close eye on evolving threats to avoid unnecessary additional costs and disruptions in time when we can truly least afford them right now. So you're already on the right track by being here today and staying informed for sure. Now, lastly, if you do find your practice in a situation where there's been a ransomware attack, I do want to point out some companies have actually come out and announced that they would be offering their ransomware services for free to healthcare organizations during this time. So these companies do a technical analysis of ransomware. They'll work with you to actually develop a decryption tool whenever possible. And then as a last resort, they can help with negotiation or transaction handling, recovery assistance, including the replacement of the decryption tool. That goes a bit further. And of course, the government's asking if you think you are a victim of a scam or attempted fraud involving COVID-19 to please report it, again, without leaving your home, you know, through a number of different platforms. There's emails, there's phone numbers, there's sites you can go to listed on here. If you have seen one that we didn't mention, this is extremely important so we all know what is out there and what to be aware of. So that brings us to the end. I think we'll go ahead and open up to questions if there are any. We hope you found this content, you know, timely and helpful. I know it's a challenging time. We truly are here to help in any way we can. So Chelsea, I'll go ahead and turn over to you to help kind of direct questions as they come in.
Okay, perfect. Thank you, Lindsay, and thank you, Alex, for presenting as well. It doesn't look like we have any questions right now, so if you have questions, now's the time to ask them. We'll stay on for a few minutes in case you do, but I know that everybody's pretty busy right now, so I know that a lot of you are probably eager just to jump off, so feel free if you don't have questions to head out. Otherwise, if you want to hang out and wait to ask your own questions or to hear other people's questions, feel free to as well. Lindsay, can you think of anything that we forgot to mention while we wait to see if anybody has questions?
You know, I haven't, and truly the main questions I've been getting from clients were just, you know, a lot of forwarding of emails of concern over reaching out from the CDC and World Health Organization. So I really wanted to make sure that you guys saw those screenshots and were aware of what those looked like, and you know, just telling your staff from here on out, hey, hover over the URL. If it looks sketchy, you know, don't click on it. They've gone past that. You know what I mean? They've evolved. You can see from Alex's slide in the beginning, as soon as there was an increase of cases of COVID-19, the domain spiked, meaning, you know, bad actors were jumping on the fact of creating a legitimate domain to get you to click on these things. So it's sad but true. You know, we're under attack almost from these ransomware people taking advantage of the situation, that they've really gone kind of the next step here to make it more difficult to spot. So anything that we can do to help, you know, as well, take the tips back to your offices that we provided of you know, straightforward things to do, especially at this work from home and telehealth environment as well.
You know, something that I just want to add, because I encountered this personally a couple weeks ago, is emails can look different on your phones, and they're not always as easy to realize that they might not be coming from who you think they're coming from on your phones. Because, you know, you might be used to opening emails in Outlook and seeing that it's from cgrover@untitled.com, Chelsea Grover, that's me. And so it might be clear if it's, you know, a fake email address that's just mimicking my name on Outlook, that's the case. But sometimes when you look at emails on your mobile phones, it's not as clear because it doesn't show the full email address. So if anything in an email seems kind of sketchy at all, definitely give it another a thorough look over before you take any action with it.
Yep, absolutely. That's a great point.
I'm guessing that there's no questions. So either we bored everyone to death or we were very thorough. I'm not sure which, Lindsay.
I'm going to go with we were very thorough, because we, you know, this webinar was actually requested by webinar attendees from a previous COVID-19, our first actual COVID-19 mini webinar series. This was requested as a topic to cover. So I'm hoping it was informational, and it truly was based off client feedback, practice feedback. You know, this stuff isn't just out there, it's impacting practices right now. So be wary. We hope you enjoy the information, and you know, thank you all for attending and taking time out of your day to be with us.
And if you have questions after the fact, you can always reach out to us in any way you can get a hold of us, and we're happy to help. You can reply back to the email that I'll be sending out within the next day or two that has a link to the slides and recording. You can find Lindsay's information, Alex's information. Any way you can get a hold of us, we're happy to help. Well, thank you all for attending, and have a great rest of your day, and stay safe and stay healthy. And thank you for everything that you do for your patients every day.